a very serious question. What if the illness that will change your life forever is already growing silently and you feel completely right? You feel completely very fine. Most people don't get sick very suddenly. They get sick quietly. Diseases like high blood pressure, diabetes, cancer, kidney disease, gum diseases, or oral cancer do not start from nowhere. They don't announce themselves and silently harm your health. And the difference between early detection and late discovery is often not money. It is not luck, or it is actually tests which matter at each age, and they matter simple, a simple decision to take this could end years of suffering, and also this could change your family's tuition. So if this sounds like you, type yes so that I know we are together and you are willing to go through this life-saving test. So these are general guidelines from major bodies like the United States Preventive Health Task Force, the Kenyan Ministry of Health, and also the Center for CDC, and also WHO. Screening should always be personalized, and it should be based on the discussion that you have with your health provider. So these are generally broad guidelines. For personalized care, always see your health provider. So why does essential screenings matter? Health is built on pillars: your nutrition, your movement, sleep, mental health, your relationships, how you manage and balance your finances, and also uh, how you balance your work. Screening is the pillar that protects all the others. After you have balanced everything else, then you need to screen. So you eat well and you eat well, you exercise, but untreated silent diseases can still undermine everything. So screening does not mean you are sick. Screening means you are taking responsibility. You want to start early, and you want to stay ahead and beat diseases before they set in. So let's do a quick poll. When was your last full medical or dental checkup? Less than a year, 1 to 3 years, more than 3 years, can't remember when, I've never done any. So just type your number on the screen so that we know how our behavior looks like. So their screening starts early, and they start from childhood, adolescence, and throughout the stages of life. So in childhood, adolescence, from 0 years to 18 years, this one, the goal of screening is to build a strong, long life foundation where you base your health on. So early life is what sets the trajectory for adulthood, physically, mentally, and even metabolically. But some of the lifestyle diseases or some of the hormone problems can set in childhood, and when you know that you have them, then the medicines can be taken early enough. So in childhood and the babies, the main thing is growth and the development monitoring, vision and hearing screening are very important because some conditions like hearing loss and even vision problems need to be addressed early enough. You have necessary immunizations, the early childhood immunizations, and each child needs to be up to date on regular immunizations. Then mental and behavioral screenings. This will screen for conditions like anxiety, depression, which starts early from the ages of 8 to 12 years. Then you have nutrition and the physical activity assessment. Then this is one of the things that many people do not really give a lot of seriousness, but it can affect a lot of issues in these young people, their nutrition, their normal well-being, and this is dental exams. The dental exams, they need to be started early from the first month of life, from the first age in life, and then routine dental checkup should be done as a routine practice between the every 6 to 12 months. So you don't wait to see learning problems in your child, or you wait for cavities to appear in their teeth, or then they have pain, and then you have a behavioral crisis, and that's the time that you start screening. So screen early, and this will give you guidance, and you stay in control. So parents here, type your child's age, and let's highlight the most important checks for that age. I'm checking to see the age group of our children and whether we have had the necessary screenings for them as we move on together. So the next age group that comes on board is the early adulthood and the young adults. This one, the main reason for screening is to detect silence risk early. We know that the morbidity of common lifestyle diseases is changing very much. Previously, it used to be difficult to see young adults in the early 20s, late 20s having hypertension. But now, this is becoming a norm that you see very young people with hypertension, you see them, some of them with obesity. And this is a trend that is worrying, but it's something that we can take control on. So what are the key screening necessary for these young adults between the ages of 19 to 39 years? One, you need to check blood pressure every 1 to 2 years if the blood pressure is normal. But if it is elevated, then you need to monitor like every 3 months. And so you see what is the trend. Then, of course, you need to give them lifestyle counseling on issues of diet, sleep, uh, managing social stresses, and managing work and the finances. Then weight and BMI and the waist circumference, they are very important in this age group, because this is the time that issues of obesity are starting to set in. You start checking the cholesterol. Usually start from the age of 20 and check every 4 to 6 years if the initial screening for cholesterol is normal. And if you get abnormal values, then you may have to check more regularly, so that your fat risk before they set in and complication also before they set in. Remember that in this young age group, if you see that the blood pressure is high, then most of the times you need to think about secondary hypertension. This is a high blood pressure which is coming as a result of another underlying condition. So you need to screen for that. Then it is important in this age group you do the blood sugar checks and screen for diabetes. And if from the age of 35, and if someone is overweight, then you need to assess more aggressively. You need many given to do glycated hemoglobin to see how well balanced their sugar has been. Then in the early adulthood, it is also good to check for sexually transmitted infections, because these ones can bring lifelong complications. And screening early based on sexual activity and the risk of the individual, then you are able to treat and detect conditions like HIV and treat on a timely basis. For ladies from the age of 21, if they are sexually active, then you need to start screening for cervical cancer with a FIA, which is a visual inspection of the cervix using vinegar. And then you notice this is an easy screening test. The results are immediate, and you are able to interpret at the point of examination. Or you can do pap smears, and if you get it as a normal examination, then you can do it every 3 years for the first uh, years from the age of 21 to 29, and then thereafter you can do it after every um, uh, 5 years. Then you also need to screen for mental health, and also screen for stressful life situations. This would be very important, so that we detect some of the conditions that can set in at this age. Then dental exams, as I said, these are the backbone of nutrition. So if our teeth are not in good condition and our gum health assessment is not maintained at par, then we may have serious complications. And remember, if you have checked some of my previous videos, there is a strong association that has been shown between gum diseases, dental diseases, and the cardiovascular risk, and even conditions like stroke. So it is very important that we maintain our dental health to avoid complications of heart diseases and cardiovascular diseases. So, feeling fine does not mean that you are healthy. It may mean that you need to be more proactive, so that you take control of your health. So, type me if you know someone under 40 who has hypertension or has diabetes or has had severe gum disease, or even with cancer, because we have seen now there are people with cervical cancer very early ages. We have seen people getting breast cancer at very early stages. As you continue, you are going to see the ages that it is necessary to screen for breast cancer. So from the age of 40 to 59 years, so the goal here is to prevent complications and detect cancer early. Again, lifestyle diseases, hypertension, diabetes, arthritis, it is necessary to screen very early. So, and this is the most important decade when it comes to health detection and the treatment. So, blood pressure is paramount at this age group. Screening for diabetes, and this should be done annually or as needed, depending on someone's BMI and also weight, and also the abdominal circumference. Then checking for cholesterol and cardiovascular risk assessment. Cardiovascular risk assessment, it means that the lifestyle risks that you have that put you at risk of getting a cardiovascular event. When we talk about a cardiovascular event, we are talking about what are the chances that you have of getting a heart attack or a stroke in the next 10 years. It's a score that is used to check that possibility. Then breast cancer screening, very important in this age group. Start discussing it at the age of 40, and then do a biannual mammography. And at this age, you need to teach ladies about self-breast awareness. This is the self-examination of the lady's breast, and also having a clinical breast examination. Of course, scientifically, what morbidity and mortality of breast cancer is the mammogram. So do it every 2 years, and also if you may need to start doing mammograms or ultrasound earlier, depending on the family risk factors. So it is very important that you know your history. You have someone in your history who have a history of having had breast cancer, and what age did it start? These are very important and pertinent issues. Then there is the mammography, which is done biannually. This should be continued up to the age of 74. Then we have cervical cancer screening. This starts at the age of 21. As I said, the initial years you do it 3 years, and then 5 years from the age of 30, from the age of 30, going upwards up to the age of 65. Then there is colorectal cancer. Colorectal cancer is one of the cancer that also starts early. The early signs start with what we call colon polyps. Polyps are outgrowths in the colon. They grow inside the lumen of the colon. And these are early precursors, even like 5-10 years before cancer presents itself. So if they can be, you can have a screening test either with a colonoscopy or fecal or cut blood testing, or fixed immunohistochemical testing for occult blood. Occult is a blood in stool. Then it can be, you can know before that you may have a risk and the policy can be removed, and the risk is the discussion should start from the age of 50, and of course, depending on the family risk, then from the age of 45, you may need to screen for prostate cancer. Prostate cancer is one of the cancer that is also very non-specific, and discussion of the family of the patient or the client between the health provider and the client, and them agreeing on what would be the appropriate way forward would be very important. So then doing eye exams and kidney checks is very important in this age group, especially for those with hypertension and diabetes. Remember that kidney failure does not just show up. It starts early, and the simplest thing that you can do for someone who has diabetes or hypertension to know whether they are getting risk of getting kidney failure is to do a simple urinalysis, because they will start having proteins in the urine, and this would be the early marker that they are getting into kidney failure. And then you may need to intensify the blood pressure control, you intensify the blood sugar control. Then lifestyle risk review. As I said, there are the 7 pillars of health that we have talked about. If you want to know more about these 7 pillars of health, then you can check my previous webinars I've been doing in the last 2 months. And this will give you how risky is someone to get lifestyle disease. And you can advise them appropriately. And the other thing that is very important, again, that we need to continue checking out is dental exams, screening for gum diseases, oral cancers, and this needs to be done every 6 to 12 months. These head and neck cancers are very significant and very critical, especially for people who have been using tobacco, either smoking or chewing tobacco, because these have been one of the major cancers in this age group. Of course, there's also cancer of the esophagus, but the cancer of the esophagus does not have any specific screening, unfortunately. So most preventable deaths and disabilities happen because screening was delayed, not because screening did not exist. If you are over 40, type ready if you would commit to at least one screening test this year. Then for older adults, people now who are more than 60 years, what do we need to do for these people? Here we are trying to preserve their lives and they extend their health span, how long they live healthy without any diseases. So you want to preserve independence and the quality of life. And at this stage, screening is not about living forever, but it is about living well and living independently without the complication of diseases. So you still need to keep checking their blood pressure. You need to check sugar levels, check their cholesterol distribution, and for ladies, especially from the age of 65, check for osteoporosis or bone wearing, and for men from the age of 70 onwards, you can check their bone density. Then, of course, you need to check vision and hearing, because these have an effect on the risk of falls and having fractures. Then screen for mental health problems, conditions like of the individual, and drugs, not more than 5 drugs, because again, and the complications for those between the ages of 50 to 80 with a history of heavy smoking. Then dental exams, tooth retention, so that we need to maintain our centenarians with good nutritional capacity. And if their teeth are not there, then they cannot be able to feed, and we need to take that. So we need to see they have maintained their chewing function, of dentures. So longevity without quality is not a success, is a failure. And so we do not to have this. So screening helps individuals to maintain their independence and they have a healthful lifestyle without the complication of diseases. So let's look at some of the myths that people have about screening and also annual regular checks. So if you're in this life, please type if you have had anybody, or if you feel that yourself you'd be ready to go for an annual checkup, or you go for a screening that is dependent on your age. So some people will tell you, I know when I feel something is wrong. Yes, diseases start with a whisper, but sometimes something like blood pressure, you may not feel anything until it is too late. So most serious diseases, including gum disease and cancer, are very silent in the early stages, and nobody will know it. Then some people you feel like screening is to check diseases that might not be there. But again, if you go in the late stages of a disease with complication, then management and reversing the condition becomes very expensive. So why not go for it early? So then late treatment is very costly, it is financially draining, it is emotionally overwhelming. So, and then some people will feel like if I screen, this will cause anxiety. But the truth is, uncertainty causes more anxiety than clarity. And many times we are overwhelmed because we have not detected early. It drains us, it drains our family, and it becomes a very complex situation. Um, Nancy presented at the age of 35. She did not have any symptoms, but she had just presented for normal clinic presentation because of other medical conditions that she had. And when we discussed with her, I realized that she had never had a pap smear, cervical cancer screening. So we agreed that she does one. And when we did, she definitely had some abnormal cells. So when she was screened, Nancy, she was found to have abnormal cervical cells. She had early removal of uterus, and up to date, she's healthy, she's strong, goes about her life. She has been able to educate her family, and now it's like 15 years or more. And so this is something that possibly she could not have known if we did not screen. So what makes you want to present late? So cervical cancer is something that can be screened early, detected and treated, and complications are prevented. And it can be detected 10 years before the full presentation of the disease. So take 10, take your time, go for the screening. Your future self will thank you. So take this 10 seconds now. Ask yourself very quietly, which screening, medical or dental, have I been postponing? And let me know from the comment section of this video what makes you postpone this screening test, and what have you dread. And this is the time. Are you willing to take the action? So let's look at what would be your screening strategy. One, look at your age and know the family history and know how your lifestyle has been. And so, what is your risk? Then start with the basics: blood pressure, your waist circumference, have a dental exam, and do this regularly. You can decide that I will be doing my annual checkups, let's say in the month of February. This is one of the months that we talk about cancer screening, we talk about lifestyle diseases, and then add specific age group cancer screening. As I've explained, and I've put a chart in the social media on the necessary screening test dependent on your age and also your risk. For example, colorectal cancer from the age of 45, mammogram for ladies from the age of 40, cervical cancer screening from the age of 21. So where do you fall? Then personalize and talk with your dentist, talk with your doctor, and then your health provider. Which test or screenings are necessary for you, and start doing it. So if you resort together and act early, start early and be ahead so that you are in charge of your health. Let it not surprise you. Make it annual. Book your next checkup before you leave here. I hope you'll do this because knowing is good, but taking action saves your life. So I've seen so many lives changed by one sentence. If only we had checked earlier. And I usually say that regret weigh heavily, but discipline and taking action weighs sense. So which one do you want? Regret or uh, the weight of doing it early? So screening is not fear. We are not looking for diseases, but we are looking for the possibility of abnormalities in your organs. Screening is taking responsibility. Screening is love for yourself and your loved one. And so do not wait anymore. Your future health is built in taking action early, not in emergencies. It is built on making the appropriate decisions at the appropriate time. At the appropriate time. So type screen in the chat if you are committing to one medical or dental screening this year. I want to see how many people are willing to take action and take it immediately, because this is your life. And please share this, because someone you love may need this as a reminder. So remember that your health depends on you. Your joy will depend on what you do, and you are the one in charge of your health. Thank you for watching. Thank you for being with me. Please type your comments in the comment section of this video. I look at all of them, and let's move closer. If this video has touched you, you can always finish the Wellness Health Services Medical Center in Machakos, and will guide you to do the necessary screenings and medical exams appropriate to your age and your risk factors. Thank you for watching. We meet in the next webinar.